a lot of the acute kidney injury after a catheterization is blamed on the contrast media, but we do know that these patients are at high risk with high atherosclerotic burden, and we are using catheter-based therapy, so there could be some atheroembolic disease that could be associated with the acute kidney injury after procedure. Those are rare, but when it does happen, it is problematic. So we use a lot of good judicious use of catheters, and the radial access is one that one can do so that you don't have to go up the aorta, especially the descending aorta on the way up. And so there are a lot of interesting attention now in this field, because we really do have to avoid that kind of a complication in a patient who's coming in with a cardiac catheterization or angioplasty. There are a couple of really, really interesting technologies that are coming in to avoid one, too much contrast media injection. So the AVERT system is a system that basically is evaluating how much, using a pressure monitor, evaluating how much of the dye has gone in, so that the extra, about 20% of the contrast media, is diverted away, and it's called the DIVERT system, actually, by Osprey Medical. A large clinical trial was done that did show in the high-risk PCI patient population that you not only reduced contrast media, and there was an association with a trend towards reducing acute kidney injury. Now, the main trial was negative for acute kidney injury, but there was no question that they were able to, with the use of the AVERT system, they were able to save about 15 to 20% of the contrast media volume. So if you can imagine, if you have a more robust system that could take away about 30%, then you can have an important impact, but those have to be evaluated. The other interesting technology that's ongoing under a clinical trial right now is the renal guard system. This is a system that basically is providing a high renal urine output by giving the patients large volumes of fluid and kind of chasing it with Lasix, weighing the urine and the urine output and measuring that very, very closely, and replacing the fluid that's being removed from the patient. So it's like state of very high volume hydration and high volume urine output, based on an old trial, the PRINCE study, which actually showed a reduction in acute kidney injury. A large prospective randomized trial is underway, and we should soon hopefully get the results of that. But you know, as far as what are the important technologies outside of minimizing contrast volume and enhancing and making sure that our patients are hydrated, there's not much else right now. There's some drug studies that are ongoing, but so far there's not been anything that has shown benefit in reducing acute kidney injury.